Welcome to this explainer. Imagine, just for a second, walking into a pharmacy with a pounding migraine, but walking out with a powerful sedative by mistake. Today, we're unpacking the dangerous naming crisis that's completely saturating the Indian pharmaceutical market, and we'll look at the high-stakes legal battles fighting to fix it. We're going to dive into exactly why finding the right medicine in India has become an absolute minefield, and what the courts are doing to try and keep our medicine cabinets safe.
Section 1. The Naming Crisis.
Okay, let's explore the incredibly high stakes of everyday pharmaceutical confusion. And, this isn't just about picking up the wrong item at the grocery store. Think about the last time you bought the wrong brand of soda because the label looked a bit similar. It's a minor annoyance, right? You take a sip, realize the mistake, and you move on. But pharmaceutical trademark confusion, that operates on a completely different, much more terrifying level. If you confuse the standard deworming tablet Medzol 400 with the powerful sedative Medzol injection, the results aren't just an annoyance. They can be catastrophic. We're talking about inducing severe medical emergencies. The margin for error here is literally zero. And the everyday reality of this market is genuinely alarming. We have Zeta Vital, a premium nutrition vitamin designed for pregnant women, sitting on pharmacy shelves right next to Zeta, a heavy-duty treatment for type 2 diabetes. Then there's AZ, a standard everyday antihistamine you take for a runny nose, potentially sitting right next to AZ+, a highly specific treatment for severe worm infections. Or take Dilantin, a crucial anticonvulsant meant to stop seizures, versus Dilantin, a blood pressure medication. Taking the wrong medication from this array of incredibly similar names could cause severe, immediate harm. A slip of a pharmacist's hand or a misread doctor's script means you might be swallowing heart medication when all you actually needed was a simple vitamin. Section 2. Root of the problem. So, how did we actually get here? Well, it all comes down to sheer volume and the unique way generic medicines are branded. To truly grasp the massive scale of this issue, consider this number. In just the 2022 to 2023 period alone, a staggering 32,320 trademarks were registered under Class 5, which is the official trademark category for pharmaceuticals. That is tens of thousands of brand new names flooding into a market that is already packed to the absolute brim. Now, I want you to compare that massive flood of new names to this number. 384. That is the actual number of essential medicines officially listed by the government of India in 2022. Just 384. That means we have a relatively tiny pool of a few hundred core active ingredients, but literally tens of thousands of different newly trademarked brand names all competing for your attention. They're all trying to carve out a unique identity for the exact same underlying chemicals. It's just an absolute recipe for disaster. A major driver of all this chaos is how generic manufacturers use what are called INN stems, or international non-proprietary names. Think of these as standard universal prefixes or suffixes derived directly from the name of an ailment, an active chemical ingredient, or a target organ. The pharmaceutical industry heavily relies on these tiny word fragments to signal to doctors what the drug actually does. It operates on the fundamental assumption that all generics are perfectly interchangeable substitutes for the original brand name drug. So naturally, manufacturers desperately want their brand name to sound like the original chemical to make it easier for doctors to remember and prescribe. Because multiple different companies coin their brand names from the exact same generic ingredient, you end up with the stem Glimipride quickly becoming the brand Gliride and Alprazolam easily becoming Alzolam. And the courts have ruled that these generic names essentially belong to everyone. They're common words in the trade, meaning no single company can legally monopolize them. So when dozens of competing companies try to create a catchy, memorable brand name using the exact same root word, it inevitably leads to a massive flood of similar-sounding brands that are nearly impossible to tell apart at a quick glance. Section 3. The Cadila Landmark. So how do the courts actually handle a market overflowing with identical-sounding medicines? Interestingly, the legal pushback started decades ago in 1962 with the Amrit Dara case. The Supreme Court recognized a fundamental, everyday reality of the Indian consumer. Many people buy medicines over the counter for quick relief, completely without a prescription. Plus, a vast majority of the population might not speak or read English perfectly. The court noted that average consumers simply don't analyze the fine etymological differences between complex, multi-syllable names like Amritdhara and Lakshmandhara. They just look at the brand name as a whole, maybe catching the start or the end of the word, which obviously makes them highly vulnerable to dangerous confusion. And this foundational logic brings us straight to the year 2001, to a massive legal clash between two pharmaceutical giants, Cadila Healthcare and Cadila Pharmaceuticals. Both companies were selling treatments for cerebral malaria. Now, this is a severe, highly fatal, last resort condition where the malaria parasite actually blocks the tiny blood vessels to your brain. One drug was named Falcigo, and the other was named Falcitab. Both companies creatively derived their names from the exact same medical term for the disease parasite, falciparum. But mixing these two up while a patient's brain is swelling, that could be catastrophic. So the Supreme Court stepped in. They ruled that because medication errors can be fatal, a much stricter legal standard is absolutely required. Even though both of these malaria drugs were strictly prescription only, the court explicitly stated that the mere fact a drug is sold under a doctor's prescription is not enough to magically prevent confusion. Pharmacists are human. Doctors have notoriously messy handwriting. The potential for human error is just too universally high when the stakes are quite literally life and death. Section 4. Doctrine of Greater Care. This pivotal ruling formally cemented a concept in Indian trademark law known as the Doctrine of Greater Care. To actively enforce this doctrine, the court laid down very specific factors to test for trademark confusion. They look closely at the visual and phonetic resemblance for sure. Do the words look alike on paper? Do they sound alike spoken aloud? But they also examine the nature of the goods, who exactly is buying them, their average level of education, and the exact mode of purchase. In the pharmaceutical realm, judges must weigh these factors with your ultimate safety placed front and center, actively presuming that a mix-up will cause profound, devastating physical harm. Section 5. Limits to the law. But, as powerful as this doctrine of greater care is, the legal safety net definitely has its boundaries. Trademark law simply can't solve everything. While it successfully stops blatantly confusing names, it draws a hard line at granting monopolies over generic characteristics. For example, the pharmaceutical company Cipla actually tried to claim an exclusive legal monopoly over the specific oval shape and bright orange color of their Norflox 400 pills. The courts firmly denied it, pointing out that no average consumer walks into a pharmacy and asks for a medicine just by describing its shape or color. Similarly, the courts completely denied a monopoly over the generic Ayurvedic term Nevarutna, because it's an ancient word that inherently belongs to the public domain. Trademarks are meant to protect distinct, creative names, not generic characteristics or everyday colors. Section 6. Curing the confusion. So, if the Supreme Court established this incredibly strict legal doctrine well over 2 decades ago, why are there still so many look-alike, sound-alike drugs crowding the shelves today? Well, the answer lies in ongoing systemic regulatory failures. First off, Section 13 of the Trademarks Act, which is supposed to actively block marks that are deceptively similar to standard INNs, is often very laxly enforced by the registry. Second, there's absolutely no mandatory pre-approval of brand names by actual drug regulators. The Trademark Office and the health authorities simply aren't coordinating. And compounding this immense danger is a stark medical reality. These generic drugs don't always absorb into the human body the exact same way. Differences in manufacturing binders can completely change a drug's bioavailability, meaning grabbing a sound-alike generic substitute might not just be confusing, it could actually alter how toxic or effective the chemical is once it hits your bloodstream. But honestly, the most shocking part? Right now, pharmaceutical companies basically operate on an honor system. Yes, an honor system. They are currently only required to self-certify that their newly chosen brand names aren't deceptively similar to existing ones. There is no independent, centralized regulatory body systematically checking their homework before a highly potent drug hits the open market. They just promise they aren't causing market confusion, and the system lets it slide. Which leaves us with this final, truly unsettling thought. When grabbing the wrong bottle or misreading a hastily scribbled prescription could literally be a matter of life and death, is an honor system really enough to keep our medicine cabinet safe? Until these massive regulatory gaps are finally closed, the heavy responsibility falls on overworked doctors, busy pharmacists, and ultimately you, the patient, to exercise that greater care. Thanks for joining me on this explainer. Stay curious, stay healthy, and always double-check your labels.